Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 40 new cases of COVID-19 in Windsor and Essex County. 18 are close contacts of confirmed cases, 20 are community acquired, and 2 cases are still being investigated. We have had 15,636 cases since the beginning of the pandemic. 384 people are active at this time, with 153, nearly 40% of our active cases having the variant. 1,021 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 91% of these cases having the UK variant. 2 cases have the South African variant and 3 the Brazilian variant. 12 people from Windsor-Essex County are currently in the hospital and 5 people are in ICU. Our community has lost 414 people to COVID. There are currently 10 active outbreaks in Windsor and Essex County, 8 workplaces, 1 long-term care, and 1 community. Now for the vaccine update, 175,715 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 161,692 people have received at least 1 dose. I was asked yesterday about our throughput at our mass clinics. With the increased vaccine supply, we anticipate the following per week for the next 2 weeks. For the WFCU, we're looking at about 730 people being vaccinated each day. Nature Fresh is 450. Libro about 500 people. Sportsplex 1,000. Windsor Hall 500. And the Moy Clinic 220. Some are working 7 days a week and some are 5 days a week. And each week, these clinics will be able to vaccinate 20,000 of our Windsor-Essex County residents. Windsor-Essex County residents 18 years of age and older living in a hotspot postal code are now able to book at 3 of our vaccine sites, Windsor Hall, the Moy Clinic, and Nature Fresh Rec Center in Leamington. All 3 of these sites are located within hotspot postal codes. The postal codes include N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. Transportation is available free of charge if needed. Please call Vets Cab in Windsor or Sun Parlor in Leamington. Residents who require wheelchair accessible taxi service can contact Checker Cab. And Transit Windsor continues to offer free rides for anyone going to and from a vaccine immunization site. The age limit across all vaccination sites for the general public is 50 years of age and older. This is for everyone outside of those living in hotspots. Please visit wevax.ca or call 226-773-2200 to book your appointment. Please note that those in the first group of frontline essential workers who cannot work from home will be able to book their vaccine appointment beginning tomorrow, Thursday, May 6th at 9:30 a.m. These are frontline workers who cannot work from home, those with public-facing roles or must work in person to deliver essential goods and services, and where protective measures such as maintaining a 2-meter distance from others is not always possible. This does not include any workers that are mostly working from home or virtually. The groups include elementary, secondary educators, custodial staff, school bus drivers, and admin staff. Workers responding to critical events, police, fire, special constables, Children's Aid Society workers, and emergency management, and those working in critical infrastructure restoration work. Enforcement, inspection, and compliance workers are also eligible. Bylaw enforcement, building inspectors, food inspectors, animal welfare inspectors, border inspection officers, labor inspectors, and WSIB field workers. Those working in licensed childcare centers and in authorized recreation and skill building programs are also eligible, including students in educational placements, licensed home childcare, and in-home service providers. Employees of a home childcare agency are also eligible. Foster care agency workers, including customary care providers, are also eligible beginning tomorrow. Food manufacturing and distribution workers, agriculture and farm workers, and funeral, crematorium, and cemetery workers are also eligible. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again today. As of today, we vaccinated roughly 37% of Windsor-Essex County residents with at least one dose of the vaccine. I want to raise the issue of vaccine confidence and vaccine hesitancy. It is an important topic for many. There are a lot of misinformation out there on social media, and various groups are very active to create doubts in people's mind about these vaccines. So far, we have a good vaccine coverage rate. More than 82% of our seniors, that is 60 years and older, have received at least one dose of the vaccine, and those living in the long-term care home and retirement home have received 2 doses of the vaccine. As a result, we are not seeing cases in that age group. We are already seeing the impact of that high immunization rate. Cases in these age groups are declining. Our facilities are no longer seeing outbreaks. This is very significant for all of us and clearly shows the effectiveness of the vaccine and the benefit of getting the vaccine early. For those who are still wondering about the dosing interval, according to a recent report, the vaccine continues to be effective even with 1 dose of the vaccine. Among those who are vaccinated, only less than 1 to 2% of these individuals end up in contracting COVID, which shows that by delaying the second doses, we prevented many new infections in the country. And when the vaccine supply increases, I'm sure we'll see further guidance on how best to use the available vaccine to protect everyone and save lives. For all vaccine-related questions, please talk to your doctor or visit our health unit website, www.wechu.org, for everything that you need to know about the COVID vaccine. Trust your doctors and credible agencies, and do not fall in the trap of social media shares that creates doubt about the safety and effectiveness of these vaccines. These vaccines are safe, and these vaccines are highly effective in preventing severe complications associated with COVID. Please visit our website for all the vaccine-related information. Once again, www.wechu.org. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. What proof will people need to provide that they can't work from home, people in those first group of essential workers?
So the essential workers will be booking their appointment online or by calling the call center, but they do have to attest that they are one of the workers, and there's information on the booking site. So once they complete that attestation, they will be able to attend the clinic. So they are not required to bring any further documentation other than the attestation.
Okay, and I know that most of the people who fit into those categories are adults, but I guess theoretically there could be someone 16 working in a recreation setting, for example. Would they be able to get vaccinated as well, or is it just limited to those 18 and older?
Right now we are doing 18 years of age and older, and because it's opening up to essential workers that cannot work from home that are out there, so that will be across all of the age spans. So anyone who is in a younger group that is working right now would be eligible, but they'd have to be 18 years of age and older.
Thank you very much.
Just to clarify, because I didn't understand when you're saying recreational worker, because the list that Teresa has gone through, it doesn't include any of these recreational facility and those workers in that category. Some of them may be included in the second group of the workers and not the first group. So make sure that anyone who is going and registering, they are following and they meet that criteria for the first group of worker. It is absolutely critical. We want everyone to get vaccinated. There is no doubt about it, but we also don't want people to jump the queue and get their vaccine ahead of the others. This particular group is already listed, and it will be very clear when you go on our website. So please read those instructions carefully instead of thinking that anyone at this time would be essential or critical worker and they should be vaccinated. go through the list and make the right choice and attest accordingly instead of falsifying any information.
Any questions from Blackburn?
No, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. As appointments open up to this first group of essential workers who can't work from home, will appointments be reserved for those individuals? Meaning, when they visit WeVax, the booking portal, and select that they are one of those essential workers, will they see appointments that maybe the 50+ group doesn't see to ensure that they can still get time slots?
The answer to that is no. There will not be a special booking pathway or reserved appointments. They will be able to see whatever is available, and they will be in the same grouping as those 50 years of age and older. So the opening up the eligibility or the booking system is just that, opening it up. They're now able to book, but they will have the same ability to use whatever is available and to book accordingly. So there are no special spaces being reserved for any of these groups. You will see whatever is available, and they'll be able to, sign up for an appointment, and as will those 50 years of age and older.
Thank you.
Any questions from AM800?
Dr. Ahmed, you mentioned 37% of our population here locally have been vaccinated. I know vaccination started with the Windsor Regional at the end of December, and then the health unit started the first of the new year here. 37%, are you pleased with that number? I know it's all based on the vaccine supply, but were you hoping more? Or where do we line up, I guess, compared to other areas in the province?
Oh, we're definitely right on top of some of the other areas of the province where with a very high vaccination coverage rate among various group. And part of our success in not experiencing the same third wave that other areas are experiencing is due to our vaccination coverage. So we are definitely very pleased with that, and we want to make sure that we continue on on that pathway and continue to protect our residents. Obviously, if we had more vaccines, we would have vaccinated more people. So there is no secret there. But so far, from the work that our team has done with all our partners involved, the city, the hospitals, and all our health system partners, I think we've done an excellent job in making sure that we have all this set up ready for the community of our size, running 4 mass vaccination clinic. That's truly amazing, like in terms of how much effort and energy that goes into planning and operating all of this. But we did this for our community, and our community responded by attending to those clinics. And so it's a great success story. A lot of work, you can imagine, has gone behind the scene to make it all happen. But at the end of the day, when we are looking at the cases, when we are looking at the progress that we are making, we are truly happy, and we want to just build up on that. And hopefully by summer, we've vaccinated everyone who wants a vaccine in Windsor-Essex.
Thank you. Just in regards to the variant, I saw in London that the strain from India has arrived in London. Has there been any indication that strain is in Windsor-Essex?
So far, we haven't seen any cases. Our EPI are obviously always on top of this, and they flag any new variant or any concerning cases that comes in our region. We know pretty much that majority of our variants are the UK variant, and so he doesn't report every cases of UK variant to me, but even at the South African one or the Brazilian one, we are notified immediately as soon as we get access to both myself and Teresa. And then our team obviously worked really hard to contain these cases as quickly as possible. So we are not aware, but we are trying our best to stay on top of all these variants now.
Thank you.
Any questions from CTV?
Yes, good morning. I know you can't loosen the provincial restrictions, but would you consider talking to the provincial officials as far as requesting regional reopening if the case counts continue to decrease in the Windsor area?
Well, I think at this time, the entire province is under that order, which will go all the way up to May 20th or around that timeline. And once those restrictions are lifted, I think that will be the timeline where we can see where we are with the cases. And I don't want to undermine the case rates. Last week when I reported on Friday, our case rate was still 82.9 cases per 100,000 population. It's not a low case rate. I think we are not seeing the same impact that we have seen. So it may feel that we are in a better spot. We are. But the case rates is still very, very high. So I just want to make sure that we're not undermining those case rates. And I would feel much more comfortable when our case rates go down less than 40 cases per 100,000 population per week, which would take at least 2 to 3 weeks before we get there if things continue to follow the same trajectory. We have seen some up and down. We have seen case rates gone down to 28 yesterday, but now it's back up to 40 again. So we're still in that cusp where things can escalate very quickly. And when the right time comes, we'll definitely look into the data, we'll look into our vaccine coverage, and we'll make recommendations accordingly.
Okay, and some restrictions are being loosened for long-term care homes. What does this mean for residents and their families?
Well, we recognize that this is an important time for all of them, and throughout COVID pandemic, there were a number of restrictions that was put in place to protect the most vulnerable in these living in these long-term care home and facility, not able to see their loved ones. And I think that's the most important part that there will be more opportunity for them to do that, but ensuring that all the public health precautions are still being followed. We definitely don't want to see any introduction of a variant case in these facilities. We know we have a high coverage rate of vaccination among our residents, but in some facilities, the staff vaccination rate are not high, and it's not where we want it to be. So I would request all of these staff to please get your vaccine as quickly as possible. And if you have any, again, going back to the whole question of vaccine hesitancy, if you have any concerns about the vaccines and their effectiveness, please talk to a healthcare provider and get yourself vaccinated. And same goes with the essential care providers. All these essential care providers, if they're visiting their loved ones in these facilities, they need to be absolutely safe. And if they're already vaccinated, it's great. If they missed that opportunity and didn't get the shot, despite being eligible for as an essential caregiver, they should get the vaccine. We want to make sure that any of these restrictions that we are loosening, we have a good plan in place to prevent any mishap or any spread in these facilities. So anyone who will be benefiting, review all these guidelines again, ensure that when you're visiting, please follow all the public health measures as implemented by these facilities for these type of visits.
Thank you. And changing gears a little, are you concerned with the increase in overdoses and the possible link to lockdowns?
Absolutely, and I think this has been a topic that we have been talking about for some time, and there are a number of partner agencies that are actively working to address the issue, but we know that the mental health impact of this pandemic, it's taking a toll on everyone, each one of us, in a different way. And people who have a pre-existing mental health conditions or a history of addiction, they are feeling the effects much more severe than the others. And these high rates of overdoses is ringing an alarm in our community, and we want to make sure that all the agencies that are working with this population are aware and are creating that awareness, distributing the naloxone kit, ensuring that all the proper education is provided to them, all the mental health support services that can be offered in this pandemic should be offered to them and to prevent this from happening. So we will be reconvening with our VCOS group, our Windsor-Essex Community Opioids and Substance Strategy, to identify any other areas of opportunity to address the issue. It is really, really important for all of us, because whether someone is dying from opioid or whether someone is dying from COVID, all these lives are important, and we want to make sure that we are not undermining any of these health impacts in any ways.
Okay, thank you.
Any additional questions from CBC?
Yes, just one. What do you make of the fact that 80% of the people who got their shots at the pop-ups on Monday were in their 20s and 30s? Does it suggest to you that most of the people who are 40 plus who are interested have already pursued those other avenues that are available to them?
I don't think so. We still have a coverage rate of around 40% in the 50 plus category, and maybe mid 30% to high 30% coverage in the 40s age group. So we still have some way to go, and recognizing that the 18 plus probably never even had any opportunity to get their vaccine in any other facility. So that's their opportunity to access these clinics, but also the pop-up clinics. The main purpose is to remove any barriers for the community that where we are going with these pop-up clinics. So I think it's great that they are rolling up their sleeves to get the vaccine, but we recognize that there's still some way to go. There's a provincial plan that was shared, I think last week, with clear guidelines on how each of these age categories will open up and to offer vaccination. We want to make sure that, in the next 3 to 4 weeks, the vaccine supply will allow us to start opening it up for everyone who needs the vaccine.
Thank you.
Any additional questions from Blackburn?
Once vaccine appointments are open to 18 plus, they say after I think May 24th is the time. How long or how many weeks would you expect to take to give everyone who wanted vaccine? How many weeks would you expect that, or do you have an estimate for that?
Well, we did look at the numbers, and we did anticipated how many people will get the vaccine, immediately jump on it and get the vaccine. So our rough estimate, and again, this is all rough estimate, our rough estimate is by the end of June and early July, we would reach to a saturation point where we will be limiting our first doses, because most people who are interested in getting the first doses would have been vaccinated by then, and then we will be focusing more on the second doses. So that's the projection that we are seeing. By end of June, early July, we should be able to offer vaccine, and we should be looking at wrapping up our first doses for the most part.
Thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AMA 100?
Dr. Ahmed, sorry, going back to the 37%, is that 37% of the population 18 and over that are eligible to receive a vaccine?
No, that's 37% of our entire population. If you're looking at just the eligible population, I believe that number would be closer to 50% now. I think 48% or something. I'll have to double check that number, but we'll be closer to that number. 37% is the entire population, which is 0 to 100 plus.
I'm not sure if you know this off the top of your head. I'm not sure if you mentioned it before. What is our current population in Windsor-Essex?
So our EPI is, so based on our census data, so 2016 census data, we use it more for our reports. And the population at that time, I believe it was close to 401,000. But then we have population projection data, so which is based on that 2021. I believe we use somewhere around 438,000 people as the projected population of Windsor-Essex at this time. But again, that's not a validated number. This is a projected number.
Okay, perfect. Thank you.
Any additional questions from CTV?
No, thank you.
Thank you, everyone. Have a great day.